Dr. Sim, we're really delighted that you're able to spend time from Kuching to be able to share with you us the information about what's happening within Sarawak involving COVID-19. This conversation is part of the Asia Research Institute's COVID Conversations. So we're looking and talking to people across Malaysia on different areas about what's happening about COVID-19 and some of the sides and issues that people are not looking at. And in particular, we wanted to speak with you because of the important work that you're doing in Sarawak. What is the situation with COVID-19 in Sarawak right now?
Okay, Sarawak, interestingly, our first case is on the 13th of March. And in Malaysia, the first case is on the 25th of January. So one of the reasons why there's such a delay is because back in January, Sarawak government start using our immigration autonomy. Any countries that is outbreak at that point of time, all the foreigners are refused entry into Sarawak. So that's why we got such a lagging behind. Unfortunately, Sarawak cannot stop our own Sarawakian coming back in, and we cannot stop any Malaysian non-Sarawakian coming in. So our case all started because of the imported cases, be it Sarawakian or non-Sarawakian Malaysian. So the first group which coming in and caused us, interestingly, that was alerted to us by the Brunei authority is someone who tested positive in Brunei, and the Minister of Health in Brunei happens to be a cardiac surgeon and my friends, and tell us that, hey, can you please trace your site? Because at that point of time, it happens to be politically very chaotic in Malaysia at that point of time. Yeah, because there's no Minister of Health for Malaysia on the 13th of March and so on. So that's how we started. But we are very sad that we lost.
It's 13:15.
We are very sad that we lost 17 patients, 17 Sarawakian to COVID-19, and we had in total about 544 patients infected. And our peak will be week 14, which is 30th of March that week. And for the last 8 days in Sarawak, we are very fortunate that despite the opening out on the 12th of May, on the quite a number of business sectors, we got 0 cases.
So, for people who are not as familiar as they should be with Sarawak, Sarawak is the largest state in the country in terms of area. There's a lot of issues in terms of border access and others, and it also has a very different public health and system, a different civil service. So, what's Sarawak doing differently, and what are the challenges that you think are unique to Sarawak in dealing with COVID-19 compared to the rest of Malaysia?
I think you are right. The local government is autonomy of the Malaysian law, because we got our Sarawak local government law back in 1958, before formation of Malaysia. And when the MCO was declared, the Chief Minister has an understanding with the Prime Minister that Sarawak is such a big state, and often people said no interstate traveling. That cannot be applied to Sarawak. What is more important is inter-district or inter-divisional traveling. Because otherwise, interstate traveling, meaning that you can travel from, in terms of Sarawak, you can travel from Penang to Johor Bahru. So there's no, and if you want to restrict movements by interstate traveling, that means that Sarawak get allowed to travel from Miri to Kuching. And so it's not applicable to us. But because the Chief Minister has an understanding with the Prime Minister, all the federal government agency, all the Sarawak agency, all come under the what they call State Sarawak Disaster Management Committee. So in this committee, the police, the army, the health department, the Sarawak government agencies such as the Veterinary Service, and all those all come under this committee. And every morning, we have meeting to thrash out issues such as people outside Sarawak want to come in, what to do, who to apply. If there are gaps in which, like the supply chain for the health department is broken, even though health is belong to Ministry of Health, but the supply chain of PPE is broken, the Sarawak government facilitate the purchase using our Sarawak government funding, chartered flight, and purchase about 6.5 million of PPE for the health department, so that at least for the last 1 month, all the hospital in Sarawak, so that the frontliners have their PPE. So all these small things helps to make a lot of difference. And also when it comes to immigration, this is Sarawak has autonomy, but the agencies we implement them, like the police and the immigration department, we have them to work very closely together. If we don't work closely together, our borders, like you said, it's not only official borders with Indonesia, at the CIQ, Sarawak borders with Indonesia is more than 1,000 kilometers of deep jungles. If we don't coordinate, right, there's a lot of what called jalan tikus. People have been crossing, like to visit their families and so on. So because all this coordination, it helps tremendously in terms of safeguarding our borders, and that's why it's very interesting to observe that during this period of MCO, with the army coming in, with the PGA, police Gerakan Khas coming in, that we had detected, they had caught a lot of funny things, funny activities. They caught drugs, they caught illegal export or the foods and so on. It's quite interesting. And in fact, I mean, we want to thank all the different federal and state agencies coming together, work seamlessly, help each other with the understanding that we never actually had the opportunity to do in the normal time.
You talk a little bit about the greater autonomy that Sarawak has, the use of Sarawak funds, and also the collaboration with the federal departments in these areas. Are there particular other challenges that you face, for example, reaching vulnerable communities? There's a lot of communities that are very remote and some impoverished. And are there things that you had to do differently than you might have done beforehand?
Yes, I think we are. One of the things, I mean, the strategy for Sarawak is we try to limit the COVID-19 to only the major town, because I mean, in the rural community, like the longhouses, carpet, and all those things, we know that if the disease reach those places, we just simply don't have enough resources in terms of hospital resources and all sorts of testing resources and so on to give them what the people in the urban area in terms of healthcare that they benefited from it. And that's why right at the beginning we had closed down the public transport, the water transport, the air transport to the rural community. But at the same time we make a Sarawak government through our Sarawak government special assistance packages, making sure that the food and essential items reach all these places, and we ensure that they reach there by government agency, be it the army, be it the bomba, or be it the helicopter through the home bill. Our Sarawak government companies which own the helicopters, flying all these essential foods and medicines to all these remote areas, because the ordinary transportation has been cut off.
Are you worried that with the holidays coming up that this will change? Are there pressures to move people into the rural areas, and will this change the kind of the orientation in terms of testing?
We have do two things. One is there is in Sarawak there's no inter-district traveling, right? And that means that unless you got the police permit. Otherwise, there's no way you can reach Kuching to Cebu. So the other thing is we had, Sarawak Disaster Management Committee had basically set the guidelines that there's no Raya visiting, no Gawai visiting this year, because we want them to be we want to protect all this community, and then if you want to celebrate, you celebrate only at home with your immediate family. So no visitings, but at home only with your immediate families. We also has go a step further, that if any Sarawakian coming back into Sarawak, we quarantine them. We quarantine them for 14 days, and so the number of quarantines, we have about 8,000 or 9,000 people quarantined in hotels paid by Sarawak government using our own Sarawak law, and some of those first thing after the quarantine done, we test everybody coming back outside Sarawak, and then if the test is negative, we put a wristband on you. And put a wristband on you, and then so that it can remaining on the quarantine at home. So we have to make use of our state law, public health ordinance, to gazette all this in order for us to have the law, the legal status to carry all these activities. So hopefully, with no interdistrict traveling, hopefully we all this quarantine. And hopefully we no visiting, that we will be able to reduce the chances of spread in the community and resulted in the second wave of the COVID-19.
So you've adopted some of the strategies that Singapore has used, which is using to track and trace many people. Are you using a software because that's not being used in other parts of Malaysia to the same degree, I understand?
Yes. So the wristband is basically is an apps that we can track you. We also make strongly encourage as many people to download called COVID Trace. Is a software that download their handphone using a Bluetooth technology, so similar to the open source code come from Singapore. So it's developed locally, and also we also going to put into as part of the SOP all the business sectors and all those things which open. We want them to call it as there's a particular software called Q Community and so on. They have to track the people for us.
So it seems that Sarawak has put a lot of resources at the state level and adopted different technology than you find in the rest of Malaysia. In terms of do you see that as being different than the rest of Malaysia? And we are a bit fortunate that our population is small. We don't face the huge number of population like in West Malaysia, that is enormous cost and so on. And what we are trying to do is we must thank the people in Sarawak as a whole. The compliance are very good, and that's why we are so successful on the phase 1, first wave and first wave of the COVID-19, and so the Sarawak government also making use, because as we are going into the we believe that digital era and digital economy, so we call all these different I call it united wars effort of pulling all the resources from all the different agencies coming together to solve issues together. And Sarawak being small, less populated, it's easier for us. One of the example is testing facilities. At the beginning of COVID-19, Sarawak may be only able to test about 200 or 300 people a day. So we realized that Sarawak is so big, how can we do 200 or 300 people a day? So we have managed to get people not only to donate, but we also to have people, agency like our forestry department, our veterinary department, sharing the PCR machine with the hospital.
not only sharing the machine, they also send the staff who are trained to do PCR to all hospital to all over Sarawak, so that at least all the now we can PCR testing in Kuching, we have PCR testing in Cebu, we have PCR testing in Miri, soon we have PCR testing in Bintulu. And we are, instead of waiting for Ministry of Health to do something, we pull all these resources together and we make it happen. This is what I call united world's effort. And this is a great spirit of Sarawak solidarity.
If you look back and so far in the experiences that you've had, what sort of things have you learned? What lessons have you learned from this experience so far?
I think one thing that I admire the most and inspired the most is that there are a lot of talents and a lot of resources spread out all over. And you can see that during this period of time, a lot of ladies at home are sewing out PPE for the hospitals, making face masks for the hospitals, and so on. These are from unexpected sources. When we are when we were waiting for PPE to come from the chartered flight from China, our industry, I mean, like the semiconductor industry, the solar panel industry, they had thousands, and these are big plants with thousands of workers. They are the one who step out and give us N95, give us isolation gowns, and without the need to being asked, because they realize that the community need to be safe first, rather than they worry about, oh, if I give the N95 mask, if I give my isolation gown, how about my business? Am I going to suffer or not? So I want to salute all these people, as well as all the frontliners. Our frontliners who work in South General Hospital, they come from all the other smaller district hospitals, coming together just to make sure Sarawak is safe.
You yourself, as a doctor, you understand these things very well. And I'm curious, as you look ahead, what sort of steps is Sarawak taking for the potential second wave? You've talked about, I mean, what as you look down the line and in that context, what things should people be aware of? Yeah,
I mean, we are very fortunate. We got the leadership headed by C.N. Amanjo, in our Special Disaster Management Committee headed by our Deputy Chief Minister, Dr. Ahmad Douglas, that we are very focused in making Sarawak safe. And so our biggest challenge that they keep emphasizing that we make sure Sarawak safe, and for the second wave, how to make Sarawak safe. There are two things. One is we need to make sure our borders and people coming in, we must have very strict guidelines of quarantines and so on. And secondly, while in Sarawak, I think we need to educate the public more, in the sense that they have to understand COVID-19 outbreak is come around because people-to-people proximity. So that's why no big gathering. That's why everything has decreased in number of capacity in order to decrease the number of people come together. So our public has been doing a fantastic job in terms of solidarity, but we just need them to continue the new norms. The new norm is try not to have a lot of people coming together in any gatherings. Then the government role is making sure that how are we going to make sure that social distancing, educate them, enforcing all this social distancing. That is on the public aspect. But at the same time, we also, the experience teach us that while we flatten the curve of the first wave, we also need to prepare the big waves, the next big wave. So that's a capacity building. A classical example, a capacity building is testing. You know that COVID-19, from the medical point of view, there are 3 T's. I mean, testing, tracing first, testing, then treatment, the 3 T's. So in terms of testing, we increase our capacity for 200 to 300 people a day to more than 3,000 a day now. And we're still trying to build that out. In terms of tracing, we help under SCIENCE, which is an agency under Sarawak government, which is to develop all the apps and all those things. has come in and stepped in to help the Health Department of Sarawak, which is a federal government agency. They help them with the tracing apps. They help them with the tracing management system for the hospital and for public health, so that they have they got a system, a computer system, how to trace, so that in case the people maybe today, the people infected in Kuching, but the people trying to contact maybe from Miri, how to be effectively communicate all these informations, and then at the same time, how the police, all the councils, health inspectors, and all the others can come in to help. So this is what I call capacity buildings, preparing for that. The biggest, I think that the most important preparing for the second wave is the public. If the public take all the precautions, when the government do their parts, then we may be able to flatten, we may have the success like flattening the first wave, and then with that, we may be able to prevent a second wave.
Well, on that wonderful note of the idea of preventing a second wave, I really thank you very much, Dr. Sim, for your time and sharing what the Sarawak experience has been so far, and wish you the best of luck. And I know it's been, as you mentioned earlier, very challenging, and there's sadly been loss of life, and there's a lot of cases that you're grappling with. So I wish all success to your disaster group and to Sarawakians as they're facing this ahead.
Thank you, and I hope everyone stay well, stay safe, and I'm very sure together we can win over COVID-19. Take care.
Take care. Thanks very much.
Bye bye.